Very worrying, I must say, from the Ashanti region. The region has 2,275 cases of COVID-19 with 38 deaths. And I must chip in a very quick correction. Earlier, when indicated that 20 doctors in the Ashanti, or almost 20 of the doctors in the Ashanti region are accounting for about 80 of infected cases, not death, infected cases. So about the Ashanti region alone is accounting for about 20 of nationwide 80 doctors who have been infected, not dead. Now, the Ashanti Regional Health Director of Health, Dr. Emmanuel Tinkrang, has been addressing a news conference today on this matter. He says the region has begun a search for more beds at both government and private hospitals because they've run out of them.
All the treatment centers are now full. Kofanoche has 18 beds. The 18 beds are now full. Kumasi South have 20 beds. So as at now, we have a total of 38 beds. All the 38 beds are now full. So what we've decided to do is that we need to expand the number of the beds that we have for the treatment centers. So we've decided that we are going to expand Kumasi South from existing 20 beds to 41 beds. As at now, we've been given another ward. Work is rapidly ongoing to make sure that we expand it. We've also secured 7 beds at Central Hospital to support our treatment facilities. And we are also negotiating with one of our senior doctors who has decided to give us his hospital to be used as a treatment center. When that one is finally done, we hope that we can add about 100 beds to the treatment centers that we have to make sure that it will be up to about 38 beds. Because the numbers that we have here and the number of cases that we are getting, it's said that we cannot contain it. The challenge we have here is the way cases are referred to our major treatment center, Kofanoche. Most of the cases are being kept in various hospitals, and when the situation gets worse, then they say, go to Kofanoche. And by the time you get to Kofanoche, less than 24 hours, then you are gone. I don't think that is good enough. We need to build the capacity of our peripheral facilities also to support the process. We'll have to build the capacity of the nurses there to identify the cases. The challenge we have with COVID deaths that we've analyzed here is that most of the deaths do not come with the classical signs and symptoms that we know. The cough, difficulty in breathing, and other things sometimes are absent. All that we get is malaria-like symptoms. So people assume that it's malaria. By the time we get to know that it's COVID, then a lot of health workers have been exposed. And because of that, most of them are now doing self-isolation. So there's a need also at the national level to review the signs and symptoms and then share it with the private facilities so that we do not focus only on certain signs and symptoms like cough, difficulty in breathing, and then it's COVID. Because in the Ashanti region, we are seeing quite different picture. It's fever and general malaise. By the time you have difficulty in breathing, then you're almost gone. So it's another work that I think we will need to do here. The number of isolation centers will also have to be increased because we are having an increasing number of cases. As at now, we have a total of 207 bed isolation centers. Yesterday, we were fortunate we discharged most of them. Other than that, we're also going to have the same challenge like that we have for the isolation, the treatment centers. So that means that we have to get more isolation centers. Already we have spoken to Ghana Registered Nurses Association, so they've given us their hostels to be used as an isolation center. So in addition to the TUC, the Edriso one, we are also going to have another isolation center. And I believe that that will also help.
That's Ashanti Regional Director of Health. He also talks about the disparity in the number of deaths reported in the region. You heard yesterday Occupy Ghana speak about it. Here's what he has to say and what the Ghana Health Service is actually reporting and why.
The information that we get relating to the deaths are passed on to national, but at the national level, they won't just put it on their platform. As far as the death, the clinical management team will also have to do what we call audits of those deaths. And if they are satisfied that all these are COVID or COVID-related deaths, before they can put it on the national platform. So you always see that there's a disparity between the figures from Ashanti region and that of the national. It's because we do a lot of work on the data before we put it in public. Just as we do for Ashanti region, we are just one region, and the national is comprising 16 regions. So for that reason, it usually takes some time. So you realize that the figures that will come from Ashanti region and that you see on the national, there's always a lag, a data lag, because of the volume of work that you have to do at the national level. So that is the reason why you see these differences. It's not real differences. It's just because of the way we process the data at our level and the way national also process their data. I must say that it's a very tedious work. It's not one-day work. Because if you say somebody has died from COVID death, you have to make sure that the death is truly COVID. That's the reason why national usually takes a lot of time, because once they put it on the platform, national platform, it ends there. Ours is more like a provisional. So that is what we need to understand, so that it doesn't create confusion between Ashanti region and the national. I'm saying this because we've had a number of calls. People wanted us to explain why our deaths is quite different from that of national. And that's the reason why we are having these differences.
So, does it make sense to you, all that we're hearing, the figures, and put that all together? Let me hear from you. Send us a WhatsApp on 0540109009. I go back to Dr. Tinkran again. Like I indicated, we know that nationwide we're talking about 80 doctors, not health workers, doctors, who have tested positive or who have been infected. Out of that, the Ashanti region alone has 18 specifically. 18 doctors who have been infected. Dr. Tinkran has been explaining how more health workers are contracting the COVID-19 in his region.
I was trying to explain it, and I told you that why are health workers getting the condition? The analysis shows that even those at the treatment centers, they don't get the condition because they are already gone, and they know that it's possible that they may have. The health workers who are now is those who inadvertently come into contact with people not even suspected to have COVID-19. The scenario we are having in Ashanti region is that those who are coming with the COVID-19 who are diagnosed, they are not presenting with the clinical signs and symptoms that may even tell you that this person may have COVID-19. Most of them are asymptomatic. They have mild, we call it myalgia, and then general malaise. Some of them are not even showing signs of fever. So they come to your hospital, especially maybe a private facility, sick just like any other person. So by the time they are diagnosed at maybe Confanoche, when the cases are becoming bad, the final common pathway is Confanoche. So in Confanoche, they test and find that all these people are now positive. So the classical signs and symptoms that will even enable you to suspect, sometimes they don't present with that. And the moment they are diagnosed as positive, then you become contact. So we are not picking the cases from the treatment centers. We are picking them all over our healthcare facilities. So now you realize that most of our healthcare workers are in isolation because people walk in like malaria and other things, and they themselves don't even suspect that it's COVID. And by the time you realize, then they've tested positive and you have been exposed and you have to go for self-isolation. You see, if it happens this way, very soon we are going to deplete most of our healthcare workers. Apart from the fact that those who will be tested positive will also have contact, who will have to go to self-isolation, the others will inadvertently have it, because these signs and symptoms that they are presenting will not even tell you that it's COVID. But as I keep on saying, you can't always grant PPEs everywhere. And that is the challenge.
We can't have PPEs everywhere. Well, it is a very worrying situation. We'll still stay in the Ashanti region. One of the key things coming up is how we are complying to the safety protocols. Dr. Tenkwan has been expressing his own worry about the level of compliance to these safety protocols. He's urging the people, especially in the Ashanti region, to take safety measures seriously.
But the bottom line with Ashanti region is that we need to adhere by the protocols and then the guidelines as has been prescribed by the president. Going around the region and especially working in Kumasi, sometimes you feel so disheartened because people don't want to adhere to the protocols and then the guidelines. Now we don't see the Veronica buckets anywhere. The social distancing protocol, nobody is observing it. You tell people to wear face masks and they are insulting you. With this, we can't fight COVID-19. People get conditioned, we want to support them, they fight with us. How can we fight COVID-19 in this situation? The buck starts with you. The president has instructed that we enforce it. This morning, I went around looking whether people will adhere to what the president said. Some of them, they've disregarded what the president said. They are still walking around without their face mask. They are not observing the social distancing. So what do you want us to do? Ask people. That is not the way to go. Because right now, you know, we've lost a doctor, a hard-working doctor. And if it's to continue this way, what will happen? We are going to lose more. So my only appeal to people in Ashanti region is that let us obey instructions. Let us adhere by the laid down protocols and then the guidelines. Because with the ease of restrictions, it's likely that we may have cases going up. The facilities that we have in Ashanti region, as far as case management is concerned, is nothing to write home about. Accra may have UGMC, they may have Kolebu, they may have 37 military hospital, they may have police hospital. Ashanti, apart from Konfanochi Teaching Hospital, we don't have any facility that we can say can manage severe and critically ill. And that means that if we continue in this direction, we will see high mortalities. So what we need to do as a region is to make sure that we adhere by the public health principles. Other than that, we will have a lot of challenges. So the media, what you can do to help us is that let us try and then talk to people. People who don't want to obey any law in this country. I believe that it's time that we deal with them. We need to enforce the wearing of the face mask. And I believe we have the support of our regional minister. Even he started. And then some civil rights organizations and other things came in and said it's against the law. Nothing is against the law more than your life. We will not continue to live in this situation in Ashanti. And yesterday, talking to the regional minister, whether you like it or not, we'll have to enforce it. And I believe that that is the only way we'll have to go. It's a challenge, but we need individuals to fight for us. We can't fight it with fear, stigma, discrimination, and other things. And then people disregarding the rules and then the law and order in this country. That's the area that we want you to do. So if you continue to help us, we can assure you that we will flatten the curves. The infection rate will continue to go down, and then the mortality will also continue to go down. But if you disregard the protocols and then the guidelines, then I'm not a prophet, but I'll tell you that the cases will continue to go up, and the mortality will continue to go up. And nobody should wake up and call Dr. Tinkran to ask me why. because I'm not going to answer you. The box starts with you. We don't sleep day in and day out. You can come here at 11 o'clock and come and see what we are doing here. By 5 o'clock, the calls will start coming. But the issue is not the health worker, it's not the president, it's about you. So that is the message to my people in Ashanti region. We love you, we want you to survive, but all that we want you to do is just to adhere by the rules and what? The regulations.
But the plain truth is simple. The more everybody gets sick, the more the health institutions are overwhelmed, the more our doctors, our health workers get infected as well, and there'll be nobody to take care of you when you're sick. And we all go down. We don't want to get there. And that's the plain truth. As we speak, 8,114 people are living with coronavirus. 8,114 people, I must say. The total confirmed cases is 12,590. Some have recovered, some have died, but 8,114 are still living with it. Good thing though is 4,410 have recovered, but many more are sick as we speak. 66 people have died, just by way of refreshing your memory. We'll take a very quick break. When we return, we go to the Ashanti region, from where we are hearing all these deep-seated concerns, lack of beds, the health institutions, as you heard from the Director of Health, are overwhelmed.